Greetings to you from the newest nation in the world, South Sudan. It's a joy and honor to be here with you today as you celebrate graduating PA school. My friends and family from South Sudan, they want to greet you as well. So on behalf of them, hello from South Sudan. Salam alaikum, salam takum, amika doro. Congratulations, you've survived PA school. It's a hard endeavor. Hopefully your late nights, stressed out moments, and periods of panic are now over, at least until you start your first job. But congratulations on making it this far. PA school is no easy endeavor, and you've accomplished a lot just by being where you are today. You know, it was only 6 years ago, in 2006, when I was sitting where you are, about to graduate from the PA and public health programs. I had no idea what my first job was going to be. I had no idea what career path I was going to take. But looking back on the past 6 years of my life, it's been more crazy and adventuresome and rewarding than I ever could have imagined. When I was a student at Arcadia, towards the end of my clinical year, I had the opportunity to spend 2 months in Bundibugyo, Uganda. And as it turned out, the very plane that I arrived on, the 2 doctors that were going to precept me ended up having to leave and come back to America on that very same plane. So I ended up working with a woman who had her PhD in public health. I did some teaching for HIV and AIDS patients, and I did research with men, investigating the life impact that HIV has on them and their families. I also went to the local medical clinic, and I spoke to the local Ugandan medical director. His name was Bagui, and I said, "Hi, my name is Scott. I'm a physician assistant, or clinical officer student as they call them there." And I said, "I would love to help. What can I do?" And in his thick Ugandan African English accent, he said, "Great! You can start seeing patients straight away. Here is a translator. You begin your work." So that was my introduction into medical missions in Africa many years ago. My first job after graduating from Arcadia University was at Johns Hopkins in Baltimore, Maryland in the emergency department. It was there that I learned the value of staying calm in chaotic situations and the importance of teamwork. A good nurse can save you from making a lot of mistakes. Your preceptors, your fellow clinicians, the pharmacists, the medical assistants, the people that you work with will be able to help you greatly. So remember to humble yourself and take on the position of a learner. When I was back in Uganda in the fall of 2007, I'd been treating patients for about 2 months when I found myself in the middle of an Ebola outbreak. It was a crazy and chaotic time in my life. My preceptor at the time, a doctor that I worked with every single day, Dr. Jonah Cooley, actually died from the Ebola virus. Before we knew what the virus was, Dr. Cooley came into the pediatric ward one day where I was working, and he asked me, he said, "Scott, I'm going to go investigate all of these patients at a nearby health center. We don't know what's wrong with them, we don't know what it is, but we as healthcare providers sometimes have to risk our lives in order to help others. If you're willing to take that risk, you're welcome to come along with me." Of course I said yeah, not knowing that it was Ebola yet, and I hopped on the back of his motorcycle to go see all of these patients, many of whom later died from Ebola. But as it turned out, on our way there, we were stopped by another motorcycle rider who said they were having a big meeting in the district that day, so we had to go to that meeting first. So we all went to that meeting, and the next day Dr. Jonah and many others went to see all of those patients. But unfortunately, or fortunately in my case, I was not able to go that day because I had a different meeting that was going on. So I don't know why my life was spared during that time. I don't know why Dr. Jonah and many other people that I worked with died during the Ebola outbreak. But I trust that there is a plan and a purpose for my life, and that there's a higher power who is in control of all things. I was working mostly in the pediatric ward, and it was there that I saw numerous children die, many of preventable diseases like malaria and malnutrition. Every Saturday, I would go visit the sick kids. I wouldn't see them clinically, but I'd always bring food with me, an avocado, a banana, or a tortilla, something small. And I would take time to sit with each child, to sit with each family. I knew that medically, I would not be able to save them all. The resources just weren't there. But I knew I could love them, I knew I could feed them, I knew I could listen to them. I'd also take a picture of every child as well. I wanted to remember those kids especially the kids that would later die. I still go back and look at those pictures often, especially the kids that did die. It's a great reminder to me why I do what I do, and it reminds me the importance of investing in people, the value of sitting with people, listening to people, loving people, comforting people, and just coming alongside people as a friend and as a fellow human being. I've learned that working in a field where life and death is often seen, it can either harden you or it can soften you. And sometimes that's a hard balance to make. That there's a lot of joy by learning to enter into other people's suffering, to come alongside them, to comfort them, to be a listening ear. I don't understand why things happen, and I never will, but I trust that there's a higher purpose who is working all things for the good of those who love him. I had the awesome opportunity to work on the Navajo Medical Reservation in New Mexico and with the Lakota Sioux Indians in South Dakota. It was there that I got to experience life on the reservation. It was there and amongst working with the urban poor in Baltimore City that I saw that many health disparities and just disparities in general exist here in America. You never have to leave the United States to see that there's a lot of disparities all around us. We as medical providers have the awesome opportunity to help alleviate some of those disparities. There are numerous inner city clinics and many places working with the rural poor that are desperate for healthcare providers. And many of them offer loan repayment programs that can help you pay back your student loans, as well as learn a lot about medicine and a lot about life. Yes, I sometimes still get words confused in the local dialect of Arabic. I often get the word for diarrhea and children confused, and many times when I'm seeing patients, I'll say to a mother, "How are your diarrhea?" instead of saying, "How are your children?" But luckily, the South Sudanese are a gracious and humble and wonderful people group, and they love to laugh with me as friends as we seek to learn from each other. The first year that I lived in what was then Sudan, but is now South Sudan, I lived in a traditional African hut, complete with a grass thatch roof. It was important for me to live amongst the people, neighbor to neighbor, and to experience what life was like for them. I like medicine. I like it a lot, and I am very proud to be a physician assistant and public health professional. But I am not solely defined by my career in medicine. There are numerous other things that I enjoy and that I'm passionate about. And fortunately, I'm able to use a lot of my gifts and skills and talents where I'm at in South Sudan to help people around me. And I hope for you, now that PA school is over, that you're able to find more balance in your life, that you're able to do a lot more of the things that you enjoy, and that you're able to spend a lot more time with the people who love you and the people that you love as well. I am blessed and honored and have the joy and privilege to say that I love what I do. It doesn't mean that every moment is a great moment. Believe me, I have lots of bad moments. But I truly do feel like I have been able to invest in people and I have been able to help people. One suffering old lady, one malnourished child, one HIV-afflicted man, one individual, one person, one life, one soul at a time. Wherever you are, whatever you're doing, try to learn as much as you can as you move towards your dreams and goals in the future. The PA profession is still very young, and you may have to do some trailblazing along the way, but don't let that stop you. You have been given the gifts, skills, and talents of a great education. You have suffered the challenges and rigors that it entails to become a PA. So I welcome you to the PA profession. I wish you good luck and Godspeed in all your endeavors. Signing off from Moondry, South Sudan, Scott J. Will, Arcadia University alumni, class of 2006, physician assistant and public health programs.